Collaboration is huge for us to do what we do here in order for a transplant to be successful. Everything has to be playing in sync like an orchestra. We have one of the best transplant groups in the world, and I truly mean that. I mean that in terms of surgical expertise. I did the first donation after cardiac death donor on EVLP in the United States. My partner, who does a lot of transplants here as well, is involved in the first implant of the total artificial heart. About 10 years ago, I used to look at the clock and say, okay, I have about 4 hours from the time this lung comes out to the time that I want it to go in. Now at times we're doing transplants with 12, 17, 20 hours out of the body, and sometimes even more. We think that that's going to increase the number of donor organs exponentially and help us to make sure that not a single person dies waiting for a lung. We are also looking at ways to offer robotics into our advanced lung space for lung transplantation. And we use a lot of imaging to identify three-dimensional aspects of the case that we're doing, and that helps us to pick the best exposure for each individual patient. There's one thing to offer our surgical expertise, but that's not the only way that we help patients. And quite frankly, while that's a very important part of it, that is only really half the picture. The rest of it is how you interact with the patient, the hope that you inspire in the patient. These things are critical to their success. When they go in with confidence, when they go in with hope and ambition and aspiration, they do better from the entire transplant journey. That is very, very important for us in Houston. That's very important for us as a transplant team. And it's really an honor to be here doing this.